Well, hello. Hi, my name is Melvin Williams. I'm a doctoral acupuncture student and integrative medicine scholar over at Juan Institute of Graduate Studies. And today, in this short lecture, I'll break down two powerful nuclear imaging tests, bone scan and positron emission tomography, PET scan, and show how the biological tools can align with TCM pattern differentiation. We'll cover today what each test measures, how the procedure works, what patients experience, and the benefits and risk. A little bit of TCM integration and with biomedical imaging, and why early detection matters in integrative care. So, as I said, my name is Melvin Williams, and today we'll be covering bone scan and versus PET scan and how this connects to TCM. I'll cite the references that I am referencing later on in the video or provide them in the link below. All right, so what are the tests today? So the tests today are bone scan, which measures the bone activity. It's used for fractures like cancer spread and infection. And then the PET scan also measures, PET scan, measures metabolism. It tracks abnormal activity with an FDG tracer. So one of them, they basically use radioactive tracers that are picked up by another device. Totally painless for the person. So what both tests, how it works is both tests involve, like I said, a small injection of a radioactive tracer. And for the bone scans, the tracer goes to the spot where the bone is repairing and remodeling. For PET scans, the tracer goes to the cells that are burning a lot of energy, like cancer cells and inflamed tissue. The scanner then picks up these signals and turns them into a functional image. Now, what the patient experiences is once the tracer is in, the patient waits a little bit, usually about 2 to 4 hours for the bone scan and about an hour for the PET. They'll lie on the table while the scanner moves over the body. It's painless, but it does take some time. Now, the benefits and the risks. The big benefit is that we can catch problems early, even before we see structural changes in the CT or X-ray. The risks are minimal, mostly just mild radiation exposure and a little discomfort at the site of injection. Now, for an integrative perspective, here's where it gets interesting for us in integrative medicine. A hot spot on the bone scan might show early bone changes. In TCM, that could align with kidney zinc deficiency and stagnancy along the DO channel. PET scans might pick up information that from the TCM lens reflects Qi stagnation and latent pathogens before full-blown disease sets in. What the results can mean is hotspots usually mean inflammation, infection, or high metabolic activity. Cold spots might mean poor circulation or tissue death. This kind of insight helps us with blend biomedical and TCM strategies, supporting constitution, moving Qi, and addressing root and branch. So in this discussion, we've already covered what the tests are, bone and PET scan, how the procedure works, what the patient will experience, the benefits and the risks, some TC integration with biomedical imaging, and why early detection matters in integrative medicine. So this clinical piece of this instruction for imaging and TCM theory is helping to encourage interdisciplinary thinking. Don't treat it as just as a branch, but learn to see how you can see the root early. If you have any further questions, I do have one closing thought for you, though, is if the functional imaging catches early detection, how could TCM diagnosis at this point in stage prevent progression into structural disease? Some of the references in which I used in this presentation, I will post in the link below. I don't want to butcher the names. One comes from a 2011 study for 18F, FDG, PET, CT imaging in oncology, the annals of Saudi medicine. Another comes from nuclear medicine, bone imaging, culture, status, and future direction, seminars in nuclear medicine. And another comes from the pivotal role of FDG, PET, CT in modern medicine diagnostics. Once again, I appreciate your time. And if you have any further questions, feel free to post a comment or send me a message to my digital message. Thank you for your time.